Good morning. Uh, I am Dr. Sayanthan, consultant pediatric surgeon, senior lecturer in surgery, University of Jaffna. Today we are going to study about the examination of lumps and ulcers. This is one of the important subject in surgical curriculum. We will see clearly each and every part. Yeah, these are the learning objectives for the students. We are going to see the overview of lump and ulcers examination techniques, understanding differential diagnosis, practical examination skills. So this lecture will improve your practical examination skills, and we will discuss a few case studies, clinical significance of findings and management strategies. So we will see one by one. In this picture, you can see um, this particular area. You can see the lump, obviously. So this is a forearm of a man. So you can see a lump here. So when you start this examination for your short case exams, usually we will allow you to take a small history. That means short history, you will just ask duration of the lump, onset, progress, associated symptoms. So these are a few important things you need to focus about this lump. So the duration is very much important. Compared to benign conditions and malignant conditions. Malignant conditions are rapidly enlarging lumps, but benign conditions, the slowly growing lumps. So second important thing, you need to start the proper examination with thorough exposure of the particular site. If you want to do upper limb examination, you need to expose whole upper limb. Similar to that, abdominal lump examination, you need to thoroughly expose the abdomen in special places. That's mean you need to have a screen, chaperone, so you need to set up the scene with adequate light. First step, as you know, examination first step is inspection. So take few seconds to have a look on this lump and adjacent area. Suppose sometime lump is be showing some special characters like pulsation. Sometimes surrounding skin will be abnormal. So always take a time to look the lump and wait for few seconds. So site is important, size and shape. Why is this site is important? Some lumps are specific for the sites. Example, thyroid lump. You know that is located in the anterior part of the neck. Some lumps are specific for the sites. You see, sebaceous cyst commonly occurs in the hairy area. So if you see the lump in the scalp area, probably sebaceous is possible. So size also important because size is important for diagnosis as well as management plan. Shape is also giving idea about the lump. A regular shape, smooth, the regular shape. So you can see both irregular and regular. And surface, always look at the surface of the lump. Surface usually smooth. Sometimes some lumps with some abnormal surface. Surface may be having some ulcers, abnormal skin color changes. So always about the thing about the surface. And already I said about skin changes. So you can include the skin changes also in your examination. The previous scar is very important because if the lump is recurrent, you can see previous surgical scar on that particular site. And sinuses and discharging small holes called as sinuses. According to the definition, sinus should be uh, one side blind tube, and that's the pathway is surrounded by the actually um, bounded by the epithelium. And also, uh, next step, your inspection. After that, palpation. Palpation, you need to uh, gently do the palpation. Before palpate the lump, always ask the patient, uh, do they have uh, pain or tenderness? So that is very important because some lumps are very painful. So if you press firmly, they may get pain. So gently touch the lump and check the temperature. Always compare with the normal side. The temperature is increased or not. So inflammatory lumps with a high vascularity, it will have more temperature than other places. And tenderness. So you know the pain, patient will feel pain when you are pressing the lump. That's called tenderness. And consistency. Consistency, I already said several times, the soft, firm hard. So soft means it should looks like a yellow, very soft. The firm, usually we will say the tip of the nose. Hard, this forehead, you can just touch and see the bony underlying structure will give the hard surface. So the lump also will show these sort of specific characters depending on the consistency of the lump. Usually the malignant lumps looks hard when benign lumps firm and some lipoma like soft lumps are there. Mobility and relation to the skin or deeper structure is very important because mobility um, indicates deep structure attachment is not much there. Suppose this lump is fixed with the deep structure, that also one of the sign for malignancy. You can see the breast cancer when they involve the chest wall, that indicates um, some bad prognosis of the malignancy. Then you can move to the percussion. So the percussions also help to uh, get some idea about the examination, especially tympanic. That means the cavity filled with air usually give tympanic sound. Example for the pneumothorax, you can see you can listen the tympanic sound. Suppose some filled cavity filled with some fluids or water, it will cause dull. Then auscultation. Auscultation always use the stethoscope. Better to use the good quality stethoscope. So some aneurysms can cause some abnormal sounds, and some time bowel obstruction sounds you can hear. Regional lymph nodes always wants to examine because the malignant conditions, the regional lymph node enlargement, tenderness, consistency, you can check. Systemic examination also part of the examination for your um, exams. So you can do the relevant examination depending on the time frame. So collectively, if we see the examination approach as a medical student, you should start with the inspection, then palpation, then percussion, auscultation, regional lymph node examination, systemic examination, relevant to the disease. Systemic examination is very much important for like a thyroid lump because toxic goiter, they may present with the lump as well as systemic signs. So the systemic examination also one of the important part for your exams. So in this slide, you can see this elderly lady with a huge goiter in her anterior neck. So this surface also not smooth. So before touch the patients, visual observation is very much important. So take a few minutes or few seconds at least, observe the patient carefully. Just observe whole. So that will give a lot of idea about the disease conditions. So when you are observing, you can see the anatomical location, dimension, shape, surface, that may be round, oval, irregular, nodular, smooth. Skin changes, redness, ulcerations, scars, dilated veins, pigmentations, and the numbers of the lump. That may be single number, multiple lumps. Any movements with respiration, swallowing, these sort of features you can do with your inspection. So thoroughly inspect first. Then you need to decide about palpation. So the inspection will give first impression and diagnostic clues, help to differentiate benign versus malignant features, guide further palpation and systemic evaluations. So always take time to do inspection. You can see in this picture clearly there's a huge goiter in the anterior neck of the elderly lady. So you know how to proceed further. So as that's why please take adequate time to have an inspection. So inspection always help you to give a proper pathway for your further management. So this is a little bit work for you. I will give few seconds to do inspection, and you are going to interpret what are you seeing these images. This is your thinking time. You can think properly. You can get many idea about this picture. You can guess the age of the patient, anatomical location, any previous scars, skin changes, approximately size of the lump, uh, and you can ask the patient to put up the tongue outside, and you can check the lump is moving or not. And same time you can do some other observation. This is a single lump or multiple lump. So you can get many information by just inspection without touching the patient. So that's very important for clinicians. So always think about inspection. That is very important. Inspection is crucial for your clinical practice. So this is the lump. You can see this is in the anterior part of the upper neck. It may be in the root of the neck. Sorry, that's the upper neck. So you can think various differential diagnosis by this lump. We will see. So the previously you have seen the picture. So you need to take a short history. Patient present with painful neck swelling that has progressively increased over 2 weeks. No history of trauma noted. So that indicates short duration of the lump. Painful. So you may immediately think about inflammatory conditions. And on your examination, lump is firm and mobile, measuring approximately 3 centimeters. No associated lymphadenopathy, no systemic signs observed. So differential diagnosis, you always think about differential diagnosis. These are the differential diagnosis possible. One is reactive lymphadenopathy, cystic hygroma, or abscess. Further imaging studies needed to confirm the diagnosis. So usually, additionally, I will add thyroglossal cyst also. So sometimes infected thyroglossal cyst may mimic same. So always think about the lymphadenopathy first because this area common with lymph nodes and other causes are less likely. But this abscess and lymphadenopathy and infected thyroglossal cyst, these are the possible causes for this picture. Another important task here, you can see there's a in this picture, you can see the elderly patient's leg, the medial side of the leg, you can see the big ulcer. Ulcer definition, discontinuation of the epithelium. So you can see the big ulcer, but you can additionally see many other structures. You see, previously this large ulcer, now it's shrinked and healing ulcer. That's become small. Again, small and getting healing. So in your inspection, you can see the site, size, shape, Number edges. Edges, especially sloping edges, are indicating healing ulcers. Sometimes punch out edges, rolled edges, undermined edges, and flow. Sometimes you can see the granulation, sloughs, and necrosis. The surrounding skins, you can see the pigmentation, induration, edema. This wound looks clean. Sometimes you can see the very bad wound with the discharge, type of discharge, amount, color, smell, everything you need to check. And next step, you need to do palpation. When you palpate, you wear the gloves, get the permission from the patient, gently do the palpation. Your main task to identify the base. So tenderness, duration of the edges and base, mobility of the laid structures, temperature, regional examination is important. Next to that, you need to do lymph node tendon involvement or not, vascular examination. Systemic examination is also relevant for some patients. So better to do systemic examination because it will influence the healing of the ulcers. Always do the examination with good adequate light with the respectable manner. You need to properly remove the pressing and get the permission from the patient, wear the gloves, and generally do the examination. So when you do the examination, your mind should tell first I am going to do inspection first, then palpation, then regional examination of the lymph node and vascular status, systemic examination. So these are the order you will follow for ulcer examination. That is very important because you know many ulcers like diabetic um, and diabetic neuropathy can cause ulcer, diabetic vasculopathy can cause ulcer, and peripheral vascular disease can cause, and also varicose vein. You know, venous ulcers commonly due to the varicose vein that is usually causing in this side, that means medial side of the lower leg. So there are so many causes for the ulcers. Always do general examination and document it, especially the measurement. You see here they have measured with the ruler. This is very important. Then only you can document it. It's getting better or not by your documentation you can assume. So always do the proper examination as well as documentation. This is the this is a case study for you. So you can see this picture and interpret some findings. So there's a large ulcer in the lateral side of the tongue. So here you can see the lateral side of the tongue. This is mainly due to type of uh, malignancy possible, but until proven otherwise, we should always think about the risk of malignancy. So here you see the age, they have given 55-year-old man with tongue ulcer. So this indicates some abnormal fluff and the erythematous edges. So remaining part also uh, candidial thrush. So you can see many things by inspection. So inspection is always important. Uh, Previous picture you can remember. The age is 55-year-old. That's man with tongue ulcer. History is usually important in the persistent pain and difficulty in swallowing alongside noticeable ulcer on the lateral aspect of the tongue. Physical examination revealed there's an irregular indurated ulcer measuring approximately 1.5 centimeter with raised edges tended to palpate and located on the lateral part of the tongue. So differential diagnosis is always important. Squamous cell carcinoma possible, candidial thrush possible, aphthous ulcer also possible, but this is very large ulcer, necessitating further investigation for accurate identification. So always we need to do further investigation to confirm the diagnosis. You know, the biopsy last time we studied about biopsy. So that is very important for this patient. As a summary, these learning objectives are: general approach to the examination is important, examination of the lung, case study we have discussed, examination of the ulcer, and then one of the case studies. So you learn a lot about the steps of examination: inspection, palpation, percussion, auscultation, regional examination, including lymphatics and vascular, and also systemic examination. So these are the key steps you will follow for your future examinations. Again, I will tell this one: inspection. Inspection take few seconds to inspect the site. Don't jump and touch the patient without doing inspection properly. Then palpation. Always ask the patient about the tenderness and concern before touch the patient. If the patient is in opposite sex, better to have a chaperone. So that is important for your clinical practice. And this inspection and palpation, always you want to do in a good, adequate light, and also um, take necessary steps to maintain the dignity of the patients. Then percussion auscultation, depending on the uh, diagnosis and needs, not always important. An important message: when you are doing abdominal examination, always think about groin examination, because the groin examination is one of the key part of the abdominal examinations. So you may aware many candidates will miss this because they will think about um, because of your exam hurry, you may not familiar with the examination of the groin and digital rectal examinations. Always do them with the abdominal examination. Any questions? Usually you may have many questions. You can contact me anytime for your doubts. So these are the important lecture for your future. Thank you.